Good afternoon, friends. I'm Dr. Shamit Chopra, a head neck surgeon at Patel Hospital. We will be talking about the measures taken as a healthcare organization as we enter the second month of lockdown from the coronavirus pandemic. As you know, we have all been very careful, and I hope all of you have been, regarding social distancing practice. We also hope that you've been following all the instructions by the local authorities. Of course, there is hope on the horizon, as we hope that the vaccines and the medications that are currently in development all across the world will be able to help us counter this disease. However, till we are able to get further control of the pandemic, we have to understand that there are certain essential healthcare services that we cannot ignore. The treatment of cancer patients is essential because any delay in treatment for the duration of the lockdown will impact their survival. Treatment of heart diseases, essential medical illnesses like diabetes and hypertension is also important, because if we don't treat them in time, that can result in life-threatening consequences. Similarly, kidney disease, GI problems, liver problems, orthopedics, head and neck and ENT are all essential services that we need to maintain as we continue our battle with the pandemic and also continue providing essential services. As a hospital and as a healthcare organization, we have always been at the forefront of providing care and taking precautions as far as the safety of our patients and our healthcare workers is concerned. I'll brief you with the hospital measures that we've taken so far as we continue providing the essential healthcare services that we talked about. We have separate access for all suspected patients to emergency and triage. We have very special precautions that we are following for critical areas of the hospital like ICU, the isolation and the OT. All documents, including a declaration and screening form that we've developed in-house, every patient who comes to the hospital will typically have to fill out this form, and only if they don't have symptoms are they allowed to enter the OPDs. And of course, we have been providing aid to our patients in obtaining curfew passes so that they can get it from their local administration, including their deputy commissioner's offices, to make sure that they can continue seeing us for their essential care. As regards measures taken for all healthcare workers and all patients, the hospital, despite having multiple blocks, now is operating on a single entry and a single exit system. Everyone who's entering, including the shift staff, including all doctors and all patients, are screened at the common entry point utilizing thermal scanners. As soon as they enter, there's a flu corner which has a separate access. We are employing social distancing at entry, exit, all waiting areas and all inpatient areas of the hospital. What that means is that everyone who's waiting in queue, whether or not they're at the pharmacy, whether or not they're at the entrance or the exit of the hospital, all have to wait in queue with a minimum. We actually recommend about 2 meters, but 1 meter is the mere minimum. We also have suspended visiting hours, so 1 attendant per patient is the norm. We have provided personal protective equipments or PPEs to all healthcare workers. These include personal gowns, face shields, masks and gloves, so that they can continue discharging their duties in a very responsible manner and also make sure that the care of patients as well as their own safety is not compromised. Taking all these precautions, we've been able to safely resume essential care like we talked about. All emergency and ICU services were functional right from the very beginning throughout the duration of the lockdown, and this again was in accordance with the instructions given by the district, state and national authorities. Now we have started doing OPDs and also doing surgeries after taking all the precautions. We have the benefit of having state-of-the-art modular OTs and ICUs, which are able to provide more isolation and we believe a better standard of care. We have also been able to resume all cancer care, including radiation, chemotherapy and all cancer surgeries. We have also been able to resume life-saving treatments like dialysis and labor and delivery services. And of course, taking it broader, we are able to have our cardiac departments, our GI liver services, kidney, skin, head and neck ENT and orthopedics, which the hospital also realizes its responsibilities in terms of reaching out well beyond its premises. All our healthcare workers have been supported with some essential ration in conjunction with the Manav Sehयोग Society, and we thank them for their support. We have also partnered with IMA Jalandhar, and we've been able to reach out to more than 1,000 vegetable vendors, and we've done thermal screening for them as part of a rotatory initiative. And last but not the least, we've been an essential partner in a dedicated COVID hospital that IMA Punjab has set up in Nakodar. We believe that by all these efforts, we should be able to not only help fight the pandemic during this difficult time, but we will also be able to provide our patients with the care that they need. In addition to this, we have started doing sample collections of our patients with suspect disease. Testing facilities, of course, are only government authorized, but we believe that sample collection and subsequent testing will help us fight this pandemic. All these measures, of course, are with the broad motive. We are confident that we should be able to emerge victorious against this pandemic and help take our country forward. We also remain committed to the healthcare of our patients and to the community. So my general message to all of you would be, if you need essential, urgent or emergent care of all the specialties that we talked about, do not hesitate in reaching out on the number that is displayed on the screen and seek a phone consult. We have also started e-consultation on the hospital website at www.patelhospital.com. However, if any of these symptoms bother you or concern you, or if you are a patient with any life-threatening disease, we will encourage that you seek care immediately, seek an appointment, and we will make sure that all the precautions are followed so that we can continue providing safe and expert care to you and your families. Stay safe. Jai Hind.